And good evening.
Hi,
Welcome
everyone.
everyone to Sunday Night Live and Rambling. I am Clay, joined by the lovely and gracious, ever sweet, ever kind E Train. We
Hi.
appreciate you joining us tonight for Sunday Night Live and Rambling. Say hey, Ellen.
Hi.
Um, it's been a good week so far, an interesting week. Are you there, or did you freeze? There you are.
I'm here.
You face kind of froze a second there.
It's okay.
Didn't know whether we were about to lose you again or not.
You never know around here.
So, E Train is once again broadcasting from one of our worldwide remote studios, and we are glad to have her with us tonight. Hopefully, the Wi Fi holds up, the bladder holds up, all that stuff holds up.
You never know.
You never know. Hello,
Hey,
Jane.
Jane.
Good to see you. Happy Sunday to you. It's still my clock's off. It's still hard for me to remember that this is Sunday. It just, I don't know, just
What
doesn't
day do you
seem
think it
like a
is?
Sunday. I honestly don't even think about what day it
Oh,
is. It's just another day. They all kind of start blending together during the summer. It's hard for me to remember what day of the week it is,
fair enough.
and which is okay with me until I realize I needed to do something on this day at this time. So thank God I've got my calendar set up to yell at me, because otherwise I would
That
be
is
extremely forgetful. I don't pay a lot of attention to the clock or the calendar,
gotcha.
for good or for bad. But glad to be with you. I only know it's a weekday when my alarm goes off to tell me I have to go to work. Yeah. Um,
Fair enough.
when you're busy and you're outside a good bit, the days just kind of blur. It's not like, I've got a fixed office job where I have a schedule every day, and meetings, different types of meetings on this day, and always thinking about what day it is. I just don't think what day it is, and that doesn't bother me a bit. It's kind of nice, actually. My animals wake me up regardless at 6 a.m. I usually wake up on my own between 5:30 and 6:30. So I don't know what's better or worse. Well, now, what kind of animals do you have?
Jane, she's got two cats and a dog.
Ah, I was thinking like livestock, rooster crowing or something.
And she's got
But yeah, I
Jamie and
remember.
Caroline, and then she's got Macho.
Can't hear you.
And then Macho. Caroline, Jamie, and Macho.
Okay. I don't know why. I was just thinking, livestock. I remember, having dogs or whatever that just wanted, as soon as the sun was up, they wanted everybody else to be up. And they'd get up, want to go outside, run around, play, eat a little bit, then they'd lay down and nap again. Anyway, the life of a dog. Well, welcome. Tonight, we're going to be talking about prescription for power, how corporations and government basically have taken over healthcare for good or for bad. We're going to kind of pull back the curtain on America's broken healthcare system. I almost named it Healthcare Unraveled, but this is a topic near and dear to my heart. For
Mine
years,
too.
I was preparing to go into medical school. Worked in hospital for 5 years. Worked in surgery for 4 of those years. Uh, Worked at the organ bank collecting organs. in preparation, and was going and decided to get married, find something else I could do to pay the bills. Because the only thing I was interested in was pediatric surgery, and it would be 11 to 13 years before I'd be able to practice. I just didn't see putting my family through that. So, but I've always maintained an interest in it, always been close to it, still read some of the literature, and am greatly, I guess, troubled by the current state of healthcare in the country. We have simultaneously the best of all systems and the worst of all systems. We have the best in terms of the availability of advanced care. We have the best in terms of skill level. We have the best in terms of research. We have one of the worst in terms of bureaucracy, the worst in expense. And it's debatable where we rank on access. So we'll look at those things, talk about the good, the bad, the ugly, and at the end, I will offer some suggestions on what I think could clean up some of the mess. Jane, this is a great topic. Healthcare is broken, which is why I went the naturopathic and herbal route for my healthcare. Keith, I think we truly know what's going on with our healthcare, what is true and what is not.
He said, oops, don't know.
Don't know. Yeah. Well, hopefully tonight we'll be able to shed a little light. Obviously, 2 hours isn't anywhere near enough time to cover all the complexity and competing inputs and forces and finances, but hopefully we'll give you a decent insight tonight. So let me...
Mm-hmm. Oh, hey, Keith.
I remembered this time.
We said hey to Jane. I didn't say hey to Keith.
Yeah. Oh, hey, Keith. How you doing? Want to make sure I don't discriminate. Now, talking about, our broken system, we're diving into a crisis that is hitting your wallet, your care, as well as your future. We're looking at the, takeover of Medicare, Medicaid. Well, we're looking at the introduction and takeover of the healthcare industry by government bureaucrats and corporations. These programs, Medicare, Medicaid, were meant to protect the vulnerable, seniors, the disabled, the low income, but instead they are fueling soaring costs. They are hiding the truth and leaving patients with what I think is far worse, far pricier options, and even billing them for crying. Yes, crying at the office. Now, kind of picture this. You're a, let's say, 68-year-old retiree living on fixed income in a rural part of the country, maybe Ohio, maybe the South, maybe the Midwest. You've got Medicare Advantage sold to you as a better version of Medicare with extra benefits. But then you need a specialist for your heart condition. You're told they are out of network. Your plan denies coverage for a critical procedure, and you're left with a $10,000 bill you can't pay. The story isn't pure fiction. It's something that many have shared in countless posts online. So what's going on? Corporate giants, government red tape are strangling healthcare, and you are paying the price. So tonight Tonight, we'll try to cover some about how Medicare and Medicaid went from safety nets to corporate cash machines, driving up the cost, absolutely bearing transparency, and also absolutely screwing over patients. We'll break it down with some data, real stories, and kind of a no BS look. So for the next hour or two, stay with us. And if you have some questions, feel free to throw them out. E-Train is monitoring Rumble, X, YouTube. And if there's a question that doesn't pass through, she will relay it. So if you have any questions, if something I say doesn't make sense, or you've got a separate opinion or something to add, feel free. This is an open forum. This is kind of healthcare unraveled. Now, remember, I just mentioned the patient getting billed for crying in the office. Well, here, the middle picture is an image of the bill. Brief emotional / behavior assessment, $40. The assessment consisted of her crying and them saying, just take a minute, calm down. And
I'm sorry, but that's freaking ridiculous.
Yeah, it's only the beginning of the ridiculousness. The lady who posted it, Camille Johnson, says, my little sister has really been struggling with a health condition lately and finally got to see a doctor. They charged her $40 for crying. The first one, I contacted my hospital for details of the bill because this is what a bill looks like for me. I don't know how all are getting real deets. Yeah, she just, got a bottom line bill for $1,200. No other information.
That's
And
it.
then this one, the third one on the end. Got surgery this past June to remove a tumor. I asked them what women's services was for. Any guesses? It was for the pregnancy test. How much did they charge for a pregnancy test? $1,900 for to sample her pee from the catheter bag and dip a stick in it. So that kind of sets the stage for what I think is one of the most screwed up systems that offers the best medicine technically in the world. Jane, if you don't fall within their outlined protocol, you are screwed. The protocols almost killed me. Doctors no longer allowed to think outside of the box. And we'll talk about that a little bit. Used to be if you went to the doctor, or the doctor came to you, the picture in this slide, doctors used to make house calls. Up until 1964, they were just middle-class citizens. They lived among their patients. They lived in their patients' neighborhoods, and they came to you if you were sick. They also did a lot, the term is pro bono, for free, but in reality, everybody would pay something. If you didn't have money, you would bake them a cake. You would go mow their yard.
A dozen eggs, whatever. Yeah.
Yeah. Whatever you could do. I had, a client that didn't have much money, but they did really, really good pen and ink drawings. And they did me a beautiful pen and ink drawing of this old church. Now, so everybody can do something.
Mm-hmm. I used to barter all the time when I was a hairstylist. Because this was, during the 2008 crisis. But people, couldn't afford to get their hair done. And I think it's really important for people to feel good about themselves. especially when they're going through a bunch of crap. So, I mean, you barter, you trade, you do whatever you have to do.
Yep. And, that was personally, I think that was much preferable to the money machine we've got cranking now.
Mm-hmm.
But what changed all this? Well, 1965, Lyndon Johnson signed Medicare and Medicaid into law, a bold move to make government the payer for health care for the elderly, the disabled, and the poor. Now, simply Medicare covers hospital stays and doctor's visits for those over 65 and some disabled folks. Medicaid, which is also largely funded by the states and the feds, targets low income families, kids, and pregnant women. The promise is that no one gets left behind. The reality is that, first of all, people didn't get left behind before. Again, the doctors would visit anybody that called. Most doctors did a lot of pro bono work, and hospitals took poor patients. Mm-hmm. Now, the honest claim that, by 1970, the defenders of Medicare and Medicaid will say 20 million Americans were on Medicare and Medicaid, and that slashed the uninsured rates. And that's true. They now officially had insurance. But that didn't necessarily mean that they had better access to health care or to the doctor, whatever. Some probably did. But keep in mind, having insurance is not the same as access. Everyone today has insurance or Medicaid, Medicare. Do you think your access is better now than it was 20, 30 years ago, 40 years ago, 50 years ago, when the doctor came to your home? For some,
No.
It probably is. For others, definitely not. So the first important thing that I want everybody to understand as we go through this is that there is no perfect solution. You always have to keep that in mind. And, here's where it gets kind of messy. The programs really didn't expand medical care. They reshaped it. Federal cash started pouring in, ballooning healthcare spending from $27 billion in 1960 to $74 billion by 1970. So over a decade, the cost of healthcare tripled. Jane, for years, I went to an old country doctor who pretty much did everything in his office, including stitches, broken bones, and basic testing. The state finally made him stop.
Exactly.
We'll talk about some of that. And is the move towards specialization really a great benefit? So federal money flowing freely into healthcare. That money standardized care, but it also brought strings. Government set prices for doctors' visits and surgeries. The interesting thing is that those prices were fairly good prices, fairly high. And doctors, this is a big key. Doctors discovered they could become millionaires by treating the poor. And the assembly line was born. They were much more efficient seeing patients in the office. Now, if you couldn't go see the doc, if you were either too sick or couldn't get an appointment, you now had to go to the hospital ER with its attendant cost and complexity. Think dollars, lots of dollars, big dollars. That is a huge fundamental shift, not in access, but in delivery. one other thing to keep in mind is that this development of federal spending and the bureaucracy and the regulations it brought with it inserted, not all at once, but particularly over time, government and corporations in between the doctor-patient relationship. Now, this is something that I have a big problem with. You ever go to the doctor and he says, well, I want, this treatment. You've got this problem. And then you go through the insurance, they deny it. They say, nope, that's not allowed. You have to do this treatment or it's not covered.
Mm-hmm.
So a lot of what the doctor can now prescribe is dictated by your insurance company. And
or PBMs.
They don't even oftentimes try to use their best judgment. They just go with the formula prescribed by the insurance company. When you go into a doctor's office, they're carrying their computer with them. And as they're typing things in as you talk to them. Well, what they're doing is typing in your illnesses and all the accepted diagnoses and the treatments start popping up as they enter in more information.
Now, every insurance company has a formulary, which is the medications by insurance company, and that list, just to give a little bit of tiny here, now
you're hard to hear.
It's now created by what is called a PM, which is a prescription something management. Anyway, they determine which medications each insurance company can use in their formularies.
Yep, PBMs. We're going to talk about PBMs in a minute. Now, so what's going on? Here's I love pictures. Here's a pretty picture. Medicare and Medicaid. They were created to ensure care for the elderly, the disabled, the low income, are the heart. They are at the heart of America's healthcare safety net. But over decades, they've morphed into something else. It's a battleground now where corporate giants and government regulators call the shots, often leaving patients like you in the dust. We will trace how these programs changed healthcare delivery, availability, and explore the rise of corporate control and ask the question, who really owns your care? Now, in all of this, doctors gave up some freedom, but they didn't complain because the money was too good. Instead of being, middle class working stiffs, they were now millionaires. They and the non-profit, quote unquote, hospitals, I always love that term, non-profit hospital, started playing by Washington's rules. The money was just too good not to. A study done in 2005 in Health Affairs journal noted that despite promises of non-interference when Medicare and Medicaid was first designed and implemented, federal regulations quickly dictated clinical decisions. So there you go. To give you an example of money, when I was working in surgery, I worked during my college years and during a time after I graduated when my mom came down with Lou Gehrig's. I wanted to be available to, to help her with physically moving her and all. My sister took care of her food and personal needs, but I needed to be around and more available. So started thinking about going back to med school and decided to take some call at a hospital, surgical call. They were short of people. I knew the charge nurse. And during that time, I worked with a rather renowned orthopedic surgeon. This guy had instruments named after him that he had designed. So one day I was talking to his SA, surgical assistant, about the money, and he told me that he said, quote, several years ago, after completing 4 or 5 surgeries that day, they were walking back to the office, and he turned around and looked at him and said, I paid for you today. I paid for you today. Now, this was in the early 90s when median income was about $32,000. The SA was probably making around 70 or 80 grand. So just extrapolating from that, the surgeon was making about 70, 75,000 a day, operating 4 days a week. Do the math. Guy was making about $12 million a year back in the early 90s.
Clay.
Yes, ma'am.
Can you hear me any better now?
Yeah. You sound okay.
Okay. I changed another setting, so I just want to make sure that the volume was okay.
Yeah, we'll keep playing with it.
Okay. Shit. Sorry.
I remember there was a time when his young boy wanted to play Little League Baseball, but the team had trouble finding a practice field. So he built one on his estate, complete baseball field with a press box, with a concession stand, with lights, stands, an electronic scoreboard, the whole 9 yards, and a parking area, just so his kid could practice. Now, do you think he minded having a little bit more paperwork to fill out before he could get paid? Nah. He just hired more office staff. Do you know now that most doctor offices have more administrative staff than they do medical personnel? Not to mention the outside legal and accounting staff necessary. Does that sound like progress to you? I mean, what kind of healthcare is it when many people know the administrative staff better than they do the medical? That's kind of back-asswards, isn't it? I mean, when you think about it, it is to me. And that's really what this chart is showing. The green is the change, the growth rate in the number of doctors. The red is the growth rate in the number of administrative staff. This goes back to 1970, when the clerical staff was less than the medical. In 2025, the clerical staff, the average clerical staff, is 10 times the number of doctors. That's backwards. Now, the real key is that government set these reimbursement rates, dictating what providers could charge. And, as some argue, it started eroding physician autonomy. And we've seen how the studies show that, yes, federal rules quickly shaped how doctors practice, from billing to treatment decisions. So costs started climbing, and not from more patients accessing the system, but a lot of it from administrative overhead, paperwork, billing, compliance. All that grew at breakneck speed. By the 1980s, Medicare's red tape was eating up 2% of its budget. I mean, in the 60s, 50s, 40s, doctors didn't have office staff, or maybe one person to help answer the phones. By the 1980s, welcome back, E-Train.
Thank you.
You were missed.
Oh, for like 2 minutes. Is it any better now?
Yes.
Good.
Seems to be good.
Good Lord. Okay.
So by the 1980s, Medicare's administrative expense was eating up 2% of its budget. Now it's between 6 and 19%. Now, some people try to argue Medicare is a more efficient provider of healthcare because its expenses are 6% and private is 7 to 9. But that leaves out a lot of cost that Medicare incurs that aren't directly paid by Medicare. For example, the IRS handles the billing, the collections. The administrative overhead, a lot of it is provided by other agencies or the executive branch. You've got accounting done by the GAO. You've got all the state expenses for the administration, office and overhead. They're in a federal office building, but they don't pay rent. But that building still costs taxpayers to build, to maintain, et cetera, et cetera. None of that goes, quote unquote, in the Medicare, Medicaid expenses. So by the time you include all those kind of expenses, then their rate would be closer to 19%. It is not an efficient delivery system. In addition, Medicare and Medicaid, since the 90s, has tried cutting some of its rates, a lot of its rates. It has, in many instances, low reimbursement rates, which means some doctors just stopped taking Medicaid patients, Medicare and Medicaid patients, especially in rural areas where there was a shortage of doctors. Now, there's never been an abundance of doctors in rural areas, but the shortage grew after Medicare and Medicaid started. Why? Well, because so many doctors realized that by running an assembly line, they could become millionaires. So why go to a rural setting where you won't have heavy traffic when you can move to a suburb and just keep running them in and out the door and become a millionaire? People complain about the lack of rural doctors now. Well, I wonder why. It's because they're incentivized not to be rural doctors. People, when they are constructing all these grand visions, I always tell my students that ideas have consequences.
Yes, they do.
And so few people think or give any thought as to the consequences of their ideas. They have in this mind a noble goal. Make sure everybody has insurance. Surely that's a noble goal. But what's the practical reality of it? Are people actually better off or not? And, anytime you hear somebody talk or argue for Medicare or Medicaid, you'll always hear them use the word access, how it improves access. They keep saying it like it's true.
Access to what?
Yeah, you can't access if there's no doc. So Medicare, Medicaid, the stage was set. Medicare, Medicaid opened doors. We'll go ahead and just say that. But it also invited control. By the 1990s, and how good is government at controlling the cost of anything?
They're not. It's not their money. They don't care.
They don't care. By the 1990s, government and private insurers saw runaway cost and started experimenting. Medicare, for example, introduced diagnostic related groups, DRGs, to try to cap hospital cost, hospital payments, I should say.
Jane.
Health plans now are pushing online visits instead of actual visits. It's very hard to get in an office now. If you do, it's an RN or PA. Yeah, we'll talk about the doctor shortage here in a minute.
I recently went to the eye doctor with someone, and there was no doctor there at all. It was like you're in the office, but the doctor is zooming in from his computer, and you watch a screen with the doctor. It is the weirdest thing I've ever seen in my life.
Huh. Yeah, the eye doctor I went to, I'll go in and they have I don't know their proper title. She wasn't an RN, but she came in and she did the eye exam, where they put it's not an otoscope. What do you call that? Anyway, and they're throwing all the lenses around. It's a mechanical deal. And then the doctor comes in and looks at her results, and he plays with the settings a little bit, just verifying what she did. But, he can do it in 1/10 the time. And, but that, that didn't bother me. That was okay. Because, I did talk with the doctor, whatever. And, he didn't act like he was rushed or anything, but it was just a little bit more efficient use of his time. Again, that assembly line thing.
Yeah, Jane said same with her, Zoom for the eye doctor. It is so weird.
Yeah.
True. And then I guess they can work for different offices all over the place too. I don't know.
And that's the way it's moving. Now, Medicaid moved to what they call managed care organizations, MCOs. And, private companies paid a fixed rate per patient. Now, I give you all the acronyms not to confuse you, but to illustrate. Each acronym represents a whole new bureaucracy, which is the absolute beauty and grace of government. It solves administrative problems by adding more administration. It's like going to your doc and you're poisoned. And what does he do? Well, he would prescribe more poison and say, take that, that's the cure. You've got the same failed administrators who couldn't control cost, developing new bureaucracy to control the cost. Does that make any sense? Seriously, does that make any sense? You're rewarding the massive fail with even more of the same fail, increasing their pay and putting them over the number of people that they manage. These shifts, were quote unquote aimed to control cost, but all they did was they didn't open the door, they kicked the door wide to corporate influence, setting the stage for today's medical challenges. Now, I love this pick. I don't know how many of you are familiar with it, but it's by a French artist, Vetter, in 1890s. It's called Corrupt Legislation. And it shows the Lady of Justice. I don't know how well you can see it. the Lady of Justice, who is hearing the appeal of the poor, downtrodden handmaiden who has an empty spindle and I forget what you call this component, but there's nothing she can produce, and she's standing amidst a fallen wall, amidst ruins, making her appeal to justice. And over here, you have presumably a politician who is reading the law, the book here, and who is putting a bag of money. I say a politician. I guess Lady Justice would represent politicians. So this would be an attorney or corporation. Pick your favorite evil. Putting a bag of money, trying to balance this quote unquote scale. And down at their foot is a vessel that has spilled over with ballots falling out of it, presumably votes that were paid for. So to me, it's interesting. This picture is, 130 years old, but it's a very apt description of today's status of the law and medical care. 2025, Medicare, Medicaid cover over 150 million Americans.
Just for the record, there are over 15 bureaucracies involved in Medicare, Medicaid right now.
Yeah, I think that's an understatement.
That's just what I just quickly looked it up.
Yeah. My daughter was working for a think tank when Obamacare was being proposed. She had to go through the bill and identify all the new bureaucracies created, and she built a flow chart. If you ever see a flow chart detailing Obamacare, it's probably hers. And she found that there were nearly 200 new bureaucracies created by Obamacare alone. Now, that's not Medicare, Medicaid, but I wouldn't be surprised by what they were in similar shape.
Yeah.
But I think we can all agree, regardless of how much bureaucracy there is, there's a bunch. And they're not the quote unquote safety nets they were portrayed to be. Corporations, government bureaucrats have turned them into a maze, an absolute maze of high cost, hidden deals, and worse care. Bottom line, worse care. Now let's break it down into what I consider to be the four big problems. Soaring cost, vanishing transparency, fewer options for patients, and I don't know any way else to describe it, but bureaucratic nightmares. It's too big of an issue to really cover every issue, but I thought I would give you a few examples of the chaos in American healthcare, 2025 edition. Ellen alluded earlier to PBMs, pharmacy benefit managers.
Oh, yeah. Mm-hmm.
These are the organizations which influence the drugs that patients are prescribed by manipulating the formularies. There's no other word for it. The formularies are the accepted list of drugs the insurance will cover. So doctors are given this formulary, and they know if they don't prescribe off this formulary, then insurance won't cover it, even if they think it's a better drug.
Different. And it's different for every insurance company.
And then the patient will have to pay it out of their pocket. They are the administrators for drugs under the Medicare system. I've got a friend who gets, a modestly expensive drug. Well, the formula, they're on Medicaid, the formulary requires that it be a non-generic original drug, even though generics are available at a 20th of the cost. But her pharmacy can't prescribe can't give her, the doc can't allow, the pharmacy can't deliver the generic because it's not on the formulary.
Yep.
Now, the PBMs will reimburse pharmacies for drugs at a lower price than they charge the insurers. Now,
wait.
insurer...
Not necessarily.
Okay, let me finish.
Okay.
The insurers, remember, will only pay a portion of the price they're charged. So what this does is actually increase your copay. This spread pricing, as it's known, ensures that the patients will pay more. Now, the beautiful kicker is the PBMs are owned by the insurers. So what this does is widens the insurer's total profit, and you pay more. It's a rigged system. So this works to increase the cost of generics as well. The PBM will bill the insurer more than they pay the manufacturer. Jane, all of these parties get paid for each prescription: pharmacist, pharmacy benefit manager, health insurance company, drug manufacturer, wholesale distributor, etc. I mean, yeah, all parties are going to make money. But what I'm talking about is a scam where the company, the PBM that they own, bills the insurance company at a much higher price than what the PBM paid. The insurance company looks at this higher price and says, oh, we only pay 80%. So they only pay 80%. You, the insured, have to pick up the other 20%. So in some cases, that 20% you pay may even be more than what the PBM actually paid for the drug. It is a corrupt system. But it gets better.
Okay. Are we going there?
Go ahead, yeah.
I was going to talk about the private pharmacy costs. Are you going into that?
Go ahead. Move a little closer to your mic.
All right. So if you are a small pharmacy, local pharmacy, and you are not owned by an insurance company, 80% of all medications that are, I don't want to say prescribed because that would be a doctor, but given out or filled, are owned by the insurance company that owns the PBM that owns the pharmacy. It's a tri-level deal. Regardless, if you're an independent pharmacist, you can order medication, charge what you think you're going to get paid back, or at least try to break even when someone comes in to get that prescription filled. The problem is when you do that, the PBM doesn't tell you what you're going to get paid or what your cost is for that medication until like 3-4 months after you sold it. So then you get a bill and then you're like, wait a minute, I'm losing money. That's why so many pharmacies have gone out of business, private, family-owned pharmacies, in the past several years, because they have no idea what they're paying for medications that they're getting until months after they've already sold them to their clients.
Yeah, the PBMs will sign a contract with the drug manufacturer to sell the drug. And so if you're a private pharmacy, some drugs you have to obtained through a PBM. Well, the PBM has a very complex system where they don't quote you an exact price. They quote you an initial price, but then they will pay you a rebate 3 or 6 months later, depending on the volume of drugs, depending on whatever other factors they want to include. So pharmacies don't have a firm number on what this rebate will be. And that's what Ellen was saying. They don't really know what their cost is. Mm-mm. They have no control over that. So PBMs, and there are only 3 of them, 3 PBMs, all owned by the insurers. And the insurers also own a lot of the pharmacies now. CVS Caremark is one of those PBMs. And CVS went out and bought Aetna, huge medical insurer. So it's vertically integrated. And they have this, complex give and take system that ensures you, the patient, end up paying more and they end up paying less. Now, Ellen indicated that PBMs, extract hidden fees or keep a portion of the rebates that they negotiate, which again increases the cost of the meds to you. They incentivize higher pharmaceutical prices by demanding higher rebates from the drug companies, which forces drug companies to have to raise their price, again costing the consumer more for out-of-pocket cost as the PBMs increase their spread. So ultimately, this is a hugely anti-competitive pricing. It is not a free market working. This is a highly regulated, corporatist market controlled by effective oligopolies. It's like a monopoly, but there's only a small handful, and they work closely together in setting prices. They are normally represented, inherently have fraud, misrepresentation. They're not benefiting the patients. They're not benefiting the doctors, nor the government who's paying for a lot of the service. Let me give you an example. There's a drug called, and I'm probably going to mispronounce it, but abiraterone. Medicare pays $3,400 per script. And last year, Medicare paid for 442,000 scripts, or about $1.5 billion for one drug. The cost to a pharmacy who can buy it direct with no insurance is $96. So if this pharmacy that was able to buy it direct from the manufacturer at $96 had the national contract, that would be $42 million, not $42 million versus $1.5 billion. So that's a savings roughly of $1.458 billion. The three PBMs are Express Scripts, Optimum, and Caremark. They tell Medicare what to pay, and they own the pharmacies, which they give bigger rebates to using the drug compared to private pharmas they don't own. So that just makes it harder for the private pharmacies to compete if there's a drug that they have to acquire from, the PBMs. The rebate plans are complex. As Ellen said, that pharmacies often don't know how much they'll be charged, and that makes it difficult to know how much to charge the patient. That's why so many are being driven out of business. It's a scam, and a huge one. Now, Ellen dug up some videos. There was one with Senator Hawley questioning a lobbyist for the PBM trade organization. We will put that up shortly after the show. It's 5 minutes long, but it's an interesting discourse. You ought to watch it. Bottom line, it's a scam, a huge one. And keep in mind, it's one that the government set up and funded. Keep in mind, the government, the people in government in this industry, the people regulating this industry, the people legislating this industry know what's going on. Where do you think the politicians get those huge contributions from? Where do you think the regulators get a job in the private sector after they've been a regulator for 5 years? We used to call it payola, tribute, slush funds, grease, whatever. Now it's just called political contributions. I'll give you a better example. There was a pharmacist in Texas, David Nurin, who recently was sentenced to 17 years and 6 months in prison for healthcare fraud. He was also, this is one pharmacist, he was ordered to pay $115 million in restitution and forfeit $405 million in assets tied to his fraud. What was the deal? Well, he concocted a scheme where they paid doctors to prescribe this compounded cream to injured federal workers. The creams were then billed to the Department of Labor for $16,000 per script, slightly more than the actual cost of production, which was about $19. The investigation revealed that these compounds were often mixed in the back rooms of pharmacies by untrained teenagers. Boom, $500 million in Medicare fraud for years by selling some dirty little cream for $19 that cost them $19 to make for $16,000. Now, they call that fraud, and they put the guy in jail. But that's the same thing that PBMs do. PBMs imitate the model. They have vertically integrated. They own the insurance. They own the PBM, the pharmacy. The insurance pays the docs to prescribe drugs with some form of reimbursement, which is now a standard procedure for healthcare in the U.S. PBMs produce the formularies, tell the doc what drugs they'll cover, what Medicare, Medicaid should pay for the drugs. The insurance pays more for the docs to prescribe a certain drug to a high percentage of patients. For example, the COVID vax, there was a leaked Blue Cross memo that showed these incentives were $1 million or more. For example, CMS paid $40 per dose and $80 for 2 doses of the COVID vax. This is just for administrative. This is not the cost of the vaccine. This is just for giving the shot. Medicare paid $45 for each additional and for each dose, and an additional $40 if the doc gave it out of the office. Like if he was, if he sent his nurses out and they ran a drive-through vax treatment, they got an additional $40 in administrative costs, solely administrative cost. Insurance companies would offer a $250,000 bonus plus higher reimbursements if 75% of the doc's patients were vaccinated. Or they would offer $1.5 million bonus if 6,000 or more patients were vaccinated. $1.5 million. I'm almost speechless every time I see this. Hospitals would receive up to $10,000 for each COVID case, just an additional $10,000 over and above the expenses they billed. ProPublica, a publishing research company, found that over 2,500 doctors received at least 500, and this is from 2014 to 2018, found that over 2,500 doctors received at least $500,000 from drug companies for promotional activities, with 700 plus receiving more than $1 million. So these were drugs for like treating diabetes or irritable bowel syndrome, whatever. This was 3 years before COVID. So this kind of pay to play is commonplace, but it's rarely discussed, much less revealed. Every doctor ought to be declaring how much he's been incentivized to recommend a specific treatment. Now, so the system is beyond broken. Welcome back.
Let's try this again.
We're going to have to E-train some updated technology or something.
I'm telling you.
You're having a hard time.
Yes, I am, but I'm trying.
Tell the pharmacy you have insurance and get a price. Sometimes you'll find out it's a hell of a lot cheaper if you use GoodRx and no insurance information.
Mm-hmm.
I always check GoodRx. Now, if y'all don't know, GoodRx is a free app, and they list non-insurance prices for all drugs from different pharmacies. So if you've got to go, if you've got a script to pick up or whatever, you can get on GoodRx and check out the price and see if it would be cheaper. Sometimes, like Jane said, it is cheaper to just pay for it yourself, not using insurance. Because remember, I talked about how insurance will sell it at a certain price or require the pharmacy. I've had the pharmacists tell me that insurance required them to sell it at this price. I take Ambien, and I can buy cheap Ambien cheaper myself than I can get it through using my deductible and insurance. It is a crazy system. All right. This slide shows the breakdown of healthcare spending by category, and you'll notice the number one cost by far in healthcare in the U.S., administration. Almost $1.4 trillion in administrative overhead for the healthcare industry. To give you a comparable number, drugs are about $420 450 billion. So that almost quadruples the drug cost. Physician salaries are about, 350 billion. Nursing salaries a little bit less. So healthcare administration is more than drugs, physician salaries, nursing salaries.
Everything else combined, pretty much, yeah.
Everything else pretty much combined. That's insane. Healthcare costs are through the roof. Medicare, Medicaid are a big reason why. In 2023, they ate up $1.9 trillion in costs, which is nearly 40% of all U.S. healthcare spending. Why? Well, corporate profiteering and government bloat. That's all there is to it. Like I say, it's a rigged system. Let's start with Medicare Advantage, the private version of Medicare. Back in the 2000s, Congress pushed these plans, saying they would, quote unquote, save money with market efficiency. You ever notice how Congress always has great ideas, great motivations? These things are a brilliant idea, but they never think that ideas have consequences. They are never concerned about the true consequences. And they never go, oh, it didn't turn out like we expected, so let's undo it. Let's reverse it. Is that a feature or a bug? Did they know what actually was going to happen and that's really what they wanted? What you think, E-Train? Feature or bug?
Depends on how you look at it, I guess, or what perspective you're using.
I have a hard time believing they didn't know, because if it was something that was opposite of what they wanted, it would be easy to reverse.
Yeah.
So if they don't reverse it, they're getting the outcome they wanted.
But did they want to get kickbacks?
It's how they get their quote-unquote political contributions.
Mm-hmm.
Follow the money.
Always.
By 2025, over 50% of Medicare's 66 million enrollees, 33 million people, are on Medicare Advantage, run by United Healthcare and Humana. Sounds great, right? Efficient. Wrong. These plans cost taxpayers more than traditional Medicare, $12 billion more in 2023 alone, thanks to overpayments and what they call upcoding. Upcoding. This is where insurers inflate patient diagnoses to get bigger checks. You have diabetes. Whoops. You've also probably got a triglyceride issue. So that's an additional diagnosis. That's an additional fee. That's upcoding. Government pays you more. Now, with all this bureaucracy, all this money flowing to corporations and bureaucrats and politicians, clinicians are continually told to do more with less. Every cost-saving initiative aimed at doctors simply adds layers of compliance and complexity, which only fuels the growth of the bureaucracy. Also, I would have you note, 3 days ago, the Department of Justice, DOJ, announced it was opening an investigation into United Healthcare for abuse of Advantage plans. they announced this. We had a public announcement, which means they started the investigation months ago and have found some stuff. And so now they're just setting up for the charges.
Well, the FTC did a whole thing on PBM's investigation, found all kinds of corruption, and did nothing.
Could
That
happen
was
again.
2 years ago. That was 2 years ago.
Different group. Different people running the show. So we'll see if something happens. I'm kind of thinking if they wanted to bury it, they wouldn't have made the announcement. It was a pretty big announcement. It hammered insurance stocks. United Healthcare has been abused. So I'm pretty much thinking that they did that because they are going to pursue some action. We'll see.
Do you know how much money an insurance agent gets to sign up? This is on any of the major insurance plans, to sign up a new Advantage member.
A little louder, please.
Do you know how much an insurance agent makes for signing on a brand new Advantage plan? They may have been on a supplement, Medicare supplement. To sign them on to an Advantage plan for the first time,
150% of premium,
$450. Sometimes the premium is nothing.
Yep. They do pay better.
And they'll also give kickbacks like $175 a month for anything in healthy foods.
And I wonder how much United Health charges Medicare, Medicaid for the Advantage plan.
No telling.
So patients, we're trying to be patient focused here. Oftentimes we'll face surprise bills because Advantage plans limit networks and deny claims. A 2022 study found 13% of Advantage claims were denied versus about 8% in traditional Medicare, often for treatments that doctors deemed necessary. And Medicaid's no better. States have handed 70% of Medicaid's 90 million enrollees to managed care organization, MCOs, another layer of bureaucracy, and a private company that rigs the game, like Centene and Molina. These firms get a fixed payment per patient and keep what they don't spend. So let me ask you, is that an incentive to deny claims?
Yes.
Or to require less costly, but possibly less effective treatments?
Yes.
Don't be surprised. I tell my students when they get into a management position, be careful how you incentivize your employees because you'll probably get them to do that. And so if you're incentivized, if you make more money paying fewer claims or buying cheaper treatments, do you think that's a course most insurance adjusters, reviewers, whatever will do? And the doctors they hire to review cases. You may have a complex cardiac issue, and your case is being reviewed by somebody that's a retired plastic surgeon that, gets a file at home and is sitting there reviewing it at home and says, no, this is not necessary. How cool is that? And then you have to go through hell to appeal it.
Why they incentivize people healthy?
Can't hear you.
Why people to eat healthier yet. So,
can y'all hear her, or is it just me? Jane, can you hear her?
If they incentivize people to eat healthier, then they wouldn't have the problems. Hello?
Yeah, you all right? Now, we haven't really talked about the hospitals and all this, but they have their share of contribution to our mess of medical malpractice, as I call it. The starting point has to be the ER. Many people can't get an appointment to a doc. There's not enough docs. You know, the states have limited the number of med schools. They want to approve new ones. They want to allow them to expand. A lot of docs don't take Medicare, Medicaid because of the low reimbursement, so they're already so busy they really don't need additional patients. So patients, have to go to the ER, clogging the ER up with simple illnesses that don't need an ER. I mean, most of us have been to the ER either for ourselves or with a friend or child, or whatever. And what's your average wait? I would say 3 to 6 hours. And tell me if I'm wrong, but 3 to 6 hours? Here in my city, the ER is often filled with stretchers in the hallways, waiting rooms, waiting treatment for hours with no one watching them. The nurses are callous, short, they are indifferent and rude, which to some degree may be expected because they may be a little overworked or short-staffed. But you'll get a bill for that one visit for $10, $12, $15,000. And it's a lot of it is simply how the state governments handle it. It makes it more difficult to open hospitals, to open emergency treatment centers. And they want to expand schools for MDs, PAs, SAs. One thing that has always irritated me is they refuse to credential Navy corpsmen or Army medics. These guys spend, years developing practical clinical medical skills, and they are some of the best trauma treatment guys in the world. They would be great working in an ER at initial triage. They can administer, prescribe, basic antibiotics. Your baby's got an ear infection. It needs, what's that pink antibiotic? Amoxicillin. You don't really need an MD to prescribe that. You come in with a cut. It needs suture. They can do that. You've got a fracture. They can set it and cast it. They could take off 60, 70, 80% of the load on the doctors, and they could treat you a whole hell of a lot faster. Pay them $80,000 a year, which would be good money for them. And it would help the ER situation greatly. Jane, drives me insane that corpsmen have to start over. They are more qualified to work in an emergency setting than 90% of the people working in the emergency room. Bingo. They have literally done it for years with some of the finest training and experience available in any setting. So the shortages of staff to me are largely contrived, maybe even planned. Then you've got the billing. Any of y'all had the joy of finding out the only ER in town uses non-network doctors? So when you get your bill from your insurance company to pay your copay, it's much higher than it would have been otherwise. And if you're going to the ER, you want to make sure you take your own Tylenol. At Costco, I can buy a bottle of 500 pills for $5. At the hospital, they're going to charge me $15 a pill. So if I'm taking 2 pills 3 times a day, that's $100 a day in Tylenol. I could buy a lifetime supply at Costco for that, just in one day. Tissues, a box of tissues. Mucus recovery system. They're $12 a box. Even better, non-sterile gloves. Like those plastic or vinyl gloves you buy at Walmart for $5 for 200. $53 a pair. Little plastic medicine cup, which costs the hospital less than a penny a piece, $10. And there's an oral administration fee added on, $6 or $10. The best thing I saw was alcohol swabs. Any of y'all go on Amazon and look to buy those little alcohol prep pads or swabs? Found one before the show, 400 swabs, pads for $6, free shipping. $6 for 400. At the hospital, $23 a piece. This, according to all these prices, came from surveys by Reader's Digest, an article in Reader's Digest. It's not my data. Data, information. I'm a researcher by trade, and so data is extremely interesting to me. Always looking for good data. And, two best places to generate data are the financial markets and healthcare. Just think about all the data you generate as a patient from your doctor, your lab test. The lab has your records as well. The hospital gets all of that. Different departments, X-ray, whatever. The nurses, all the nurses' notes, etc. Tons of information. Well, the government has mandated a number of electronic record-keeping systems, promising efficiency. Had a neighbor who was a PA that had his own clinic, and he mentioned that Obamacare, this was back in 2012, 2011, that the system Obamacare was making them get was going to cost him $90,000 just for the software. $90,000. Who pays that? And increasingly, we've seen where, doctors are becoming glorified clerks. They've got so much paperwork and stuff they have to fill out. Their patient face time has dropped. Burnout rates have soared. You've got, laws passed to protect your privacy. HIPAA. HIPAA is more often used to avoid transparency than protect privacy. I have a hard time getting my records and my info because of HIPAA. It's irritating as hell. I have to go through hoops, file forms, etc. It's ridiculous. And big tech now is just absolutely licking its chops at getting its hands on your medical data. Google Health, Amazon Pharmacy. They're buying into the medical industry so that they can access medical data, and they can monetize that data and use it to target you for specific products, treatments, whatever. So where's all this headed? Well, if corporate and government control keeps increasing, keeps tightening, just continue to expect worse. In 2022 alone, I have a hard time finding more current records. Healthcare lobbyists spent over $700 million on lobbying. That's a lot of money. Medicare Advantage plans will dominate Medicare by 2030. It's estimated there'll be 70% of all plans. This will effectively lock seniors into far more restrictive plans. Expect AI to be implemented to spur and increase claim denials. Make care even harder to get with algorithms overriding doctors' judgment. You become a statistical event, and the statistics will be used to determine your care rather than your doctor's knowledge, understanding, experience. I mean, I've been around doctors that are, were good in school, but they have poor clinical skills. I've been around doctors who didn't graduate, magna cum laude from their medical school, but they had great clinical skills. I know which doctor I would choose to treat me, and it wasn't the one that was the best statistician. Expect costs to keep climbing. Healthcare spending is projected to hit $7 trillion by 2030. Look at insulin. The cost of insulin, it's up 600% in 20 years. It's real simple. It's not a free market. It's a rigged game. Now, all of this, I don't want to, sound hopeless. There is a way out. And whether you love him or hate him, Trump listed one way in his executive order detailing pharmaceutical cost, which a court probably will throw out. But he directed big pharma, to develop direct to the customer sales networks, the customer being the pharmacies. This would cut the PBMs out of the picture altogether. Screw their formularies. Your health care is between you and your doctor, and he prescribes what he thinks is in your best interest. He doesn't get the PBM's cutbacks, rebates, whatever. Pharmacies would know what their price is and then could charge a fair, competitive price. You could shop amongst pharmacies. It would also protect independent pharmacies instead of forcing you into one that is owned by the insurance company, or at least give them a chance to compete. And the practical reality is this would greatly lower the cost net to the patient. A second thing that I think would be helpful and is necessary is to end employer-mandated health insurance. This has greatly confused the issue as to who's the patient or customer, and it's only ended up increasing the cost and complexity of insurance and delivery of care. You allow the customer to buy the specific protection he wants in a free market with simpler plans and clear pricing. It ultimately will put you back in charge of your health care, takes all the middlemen out, removes a dozen middlemen that have inserted their fingers into your health care delivery. Third step, allow doctors and hospitals to advertise their prices. If they receive federal funds, require them to do so. So a hospital has to list what it charges for this service. Everybody pays. Fourth, remove the restrictions on new medical schools. Allow medics, corpsmen to use their skills. Expand PASA schools. We have a shortage of medical care providers. Quit choking off supply. Bring back LPNs. Not every nurse needs to be an RN. It's just unnecessary. 5, eliminate HIPAA. Forbid any privatization or sale of medical data unless it's for blind research services. So, the hospitals with the medical data could sell it for a nominal cost to researchers, strip out all the names, personal data, and, just say male age 65, diabetes, whatever, and allow the use for research purposes. 6, allow opt-outs of Medicare and simplify payments and coverage. Right now, it's a complex system of if this or this, then this. No, just, you pay the first $500 a year. The next $5,000 is paid, 80%. After that, 100% paid up to $1 million for medical surgical care. If you want mental, pay extra. If you want delivering babies, pay extra. Whatever. But just basic health care coverage. Also, allow people and Medicare, Medicaid to pay docs a flat fee for basic medical care. I've known some groups that do this. They will charge you $500 a year, and you get 2 office visits, and then anytime you're sick or whatever, you get a free visit for primary medical care. And so you know exactly what you're paying and how much. It's in your budget regularly. You can go to the doctor anytime you need to, and you get 2 routine checkups a year. It cuts billing expenses. It steadies the income for docs. It eliminates managed care and bureaucracies, which nets more money to the doc. It's a win-win. You pay less, you get as good or better care, the doc gets more money with less headaches, less paperwork. 7th change I would like to see, or 7th idea. Right now, what I've seen out of the dude, RFK, give him whatever he wants. He is on the right track. He is trying to get medical care refocused from treating a disease to preventing disease in the first place. Focus more on health, good food, good nutrition, what goes into the food we eat. Encourage people to exercise, get up and move more, and eat cleaner. I'm a huge fan of that. I think that is grotesquely underestimated in its significance and value to health in this country. And then 8, I would like to see some malpractice protection for Medicaid providers. So if you take Medicaid patients, you have protection from malpractice lawsuits. Your risk would only be limited to actual damage. So if you had some event of medical malpractice and you cost this person 6 months of wages, you would owe that 6 months of wages. There would be no pain and suffering. Now, I realize this is not ideal if you are injured by medical malpractice. But 1, this would become public record. The doctor should have to disclose it. Secondly, if that doc gets hit for $5 million in pain and suffering, who pays for that? You do. Everybody that uses the healthcare system pays for it. It just drives the cost up. When I was, back in surgery in the 90s, I was talking to a OBGYN who was quitting the OB part. He said, and this was back in the mid 90s, he said his insurance premium for delivering babies was $150,000 a year. And he said he had to spend 1 day a week with an attorney. So he was charging $3,000 for a delivery. So that's 50 babies just to pay his insurance, not counting his legal fees. And so he was giving up the practice of OB and just going to concentrate on the GYN. That's not good for anybody. So we need some reasonable, if not perfect, solution to the malpractice epidemic that we have going on in the courts. So those are, a few of my suggestions. What do you think? Do you have any others? Anything you'd like to see or any other ideas that you have? Be glad to hear them. Looks like we have lost E-Train to the tech demons. Bless her heart. She has really struggled with that, and we'll see if we can't get that cleared up. This is getting a little silly. Anybody have any other questions? Jane, I'm studying to become a wilderness first responder, so I can take care of myself and my family before we go to a hospital again. Self-sufficiency is a good thing. Too many people have no acute awareness of their health, how to stay healthy, or how to take care of minor issues. These ought to be covered in class. Some of this basic stuff, first aid, treatment, etc., should be covered in elementary and high school. I don't know why we don't do that anymore. We're damn sure not consumed with making them learn to read or write, so they might as well learn about Band-Aids. Hell if I know. So, anybody have any other questions, comments? There's I kind of forgot the slide. When Ellen's not here and I have to, do all the stuff, I kind of get a little absent-minded there on some of the things. Sorry about that. But that's my list of suggestions. For those of you watching, if you will, I'd like to remind you to please hit the like and or subscribe buttons. That helps us out. Will take you just a second, but would be greatly appreciated. I was going to, talk about Trump, but this ran a little bit long, and so I will save the discussion on Trump reshaping the world. And some of this I think is fascinating. Don't know how it's all going to work, but there's a whole lot that's going on behind the scenes and that's not being discussed. We'll, take a look at that Tuesday night. And I hope you'll join us Tuesday, same time, same station, 7:00. Tuesday night Q&A. Obviously, we'll talk about Trump, but if you have some other questions, something hit your mind, that's a good night to bring them up. You can email me at moffettonmoney@gmail.com or DM me on X, Moffettonmoney. Be glad to hear from you. A lot of the ideas, a lot of the discussions we have come from your comments and emails. So we do greatly appreciate those. That's it for me. I appreciate y'all watching. I hope y'all have a good week ahead. E-Train and I will look forward to seeing you Tuesday night. Blessings to you all. Our time is up. We thank you for yours. Good night, y'all.